Pain podcast. I'm Dr. Vince Rampersaud. I work at Insight Institute for Pain Management. My background is in orthopedic surgery as well as pain management. I've been practicing pain management for about 15 years. I've been at Insight for about 10 years, and we take care of a multitude of patients with a multitude of problems. Evan?
Thank you, Dr. Rampersaud. I'm Dr. Evan Peskin. My background is anesthesiology and then interventional pain. I did all my training, everything at University of Miami. I was lucky enough to join Insight a year and some change ago, and I'm very clearly seeing the light and what direction we're going. So the point of our podcast today, we're going to be covering the wide world of pain treatments from the bottom all the way to the top. Every question, every concept that people want us to talk about, that's what we're here for. Plus, we have a very, we got a good dynamic, you and I. I think people will pick up on this. I'm going to say electricity. So our topic today is conservative care mechanisms for pain. And this includes treatments like physical therapy, aquatherapy, massage therapy, chiropractic care, and transcutaneous electrical nerve stimulation. So that's a heck of a sentence right there, Ramp. That is like, we
It
just
is.
five
It is.
different fields of care. And I think we could probably spend the next year going into the clinical evidence, the background, the treatment, the unique stories, everything. But
Right.
let's make sure that we talk about stuff that we're going to help the widest range of people. So let's start with number one. Dr. Rampersaud, I'm going to ask you, what exactly is conservative care when you talk about pain management?
So when we talk about conservative care, we're talking about interventions that don't leave a lasting effect as far as side effects on a patient. For instance, if we talk about surgery, there's risks that come with surgery, but sometimes surgery is necessary. But there's always a risk of injury to nerves, blood vessels, to the skin, risks of infections. As far as epidurals and injections go, there's also risks, albeit significantly less than perhaps surgical intervention. And even when we talk about medications, especially opioid medications, the risk of addiction, the other risks of what we call metabolic changes on the body are there. So these are modalities that can leave long-lasting effects. So when we talk about conservative care, we're talking about treatments that, for the most part, leave no mark. We're talking about treatments that people can generally do at home and can do for the rest of their life that can result in significant improvement of injury, improvement of pain. I'd say that that's it in a nutshell.
Sure. So for me, when people talk about conservative care, every time I ever meet a patient, I'm kind of like, what's it, Woody from Toy Story? Like you pull my string. I have the same thing I tell every patient in the beginning, who I am, how we practice medicine. And then when I talk about treatment, there's always three big categories for me. There's conservative care, there's minimally invasive and medical management, and then there's more invasive treatments. And so in generality, physical therapy versus epidurals versus a spinal surgery. And of course, every case is unique. Medicine, especially pain medicine, is not one size fits all. This is meant to be unique. People are unique. Their pain is unique. Their treatment should be unique as well. So when I talk about that first, in generalities, that first category of conservative care, I express to people that this is meant to be low risk, safe, early treatment. I have patients who say to me, they're like, look, I've had back pain for 10 years. If you tell me physical therapy is going to fix this back pain, I was like, no, that's not what I'm trying to say. I'm saying that you don't build a house and only focus on the walls. You focus on the floors and ceiling and the internal, everything else. It's not one thing by itself that makes a house. It's all the different components coming together. So physical therapy for me, for the vast majority of cases that we see, musculoskeletal injuries, joint injuries, degenerative changes from aging, from surgery, from trauma, I believe conservative care, such as physical therapy, is the floor in which we build everything on. It's not only going to have a lower side effect profile, like you just discussed. Every medication we talk about, we discuss side effects, interactions, how it works, expectations, physical therapy, and other conservative care mechanisms. we don't really spend as much time talking about side effects because they don't have the same one.
Hmm.
It's meant to help support and build a structure for recovery. So let's say I broke my knee, and for sure, we talk about conservative care, minimally invasive, and invasive treatments. If I broke my knee, I trust our orthopedic surgeons are amazing, good human beings, great doctors. So we talk about Dr. Shupak, Dr. Sarmas, Dr. Jamail, who, if they see a shattered knee and they're like, hey, surgery is going to fix this, I 100% support it. Let's say I broke my knee and it's a hairline fracture, and it's ironic, an anesthesiologist lecturing an orthopedic surgeon about a hairline fracture, but let's just pretend that I know what I'm talking about. So there may be medical management, anti-inflammatories, maybe a joint injection or a nerve block to help with the pain. But before the surgery and before medications and injections, you can always discuss and consider physical therapy. Physical therapy is not going to fix and grow back a fracture and heal a fracture, but it's going to help support the muscles, the tendons, the ligaments that keep that structure aligned and supported. If we were just a skeleton, we would collapse into a pile of bones on the floor. It's the associated soft tissue, musculoskeletal structure that keeps us aligned, that keeps us organized, and that keeps us walking around, keeps you looking as good as you do. It's not the skeleton underneath, it's the muscles and support on top of it that keep us well organized and functional. So I believe conservative care is a low risk, safe, conservative treatment that can help support, strengthen, augment other care, other treatments, and create a foundation to allow patients to kind of have some self-efficacy and some own control on their treatment. I think it's remarkably important.
Perfect. And just like you said, physical therapy becomes a foundation before we do anything else. Because if physical therapy works, then we don't have to delve into those more invasive, more
Risky.
albeit some may be low risk, but there's still more inherent risk associated with them. So then we come across, some patients who work very physical jobs, and they say, Dr. Rampersaud, I understand that you want me to do physical therapy, but I do physical therapy every day in the job that I do. I'm moving packages. They're heavy packages. I am strong. You have no idea. And I say, well, do you wake up every morning and do you stretch? Do you do yoga? Do you prepare yourself for the day? And they say, well, no. And I said, well, if you were a football player, do you only play the Super Bowl? Because I mean, to me, that's what your job is. Your job is like the Super Bowl. Your job is a game. It's not a scrimmage, it's a game. And if you don't give it your all, you don't get paid.
I mean,
So, I mean, football players have to practice. They have to do therapy. They have to have trainers. And that's what physical therapy does. And I think the physical therapy is a lifelong thing. No matter what else we do, whether it be injections, whether it be surgery, the physical therapy, sometimes even massage therapy, the TENS units, sometimes even acupuncture are all things that augment our lives to reduce pain in the long run and help us ultimately have enjoyable
quality of life.
prosperous and good quality lives. I mean,
I
that's really it in a
I
nutshell.
absolutely agree. And you know what's really funny is you just hit on something that I talk about all the time, which is through other projects and experiences I've worked with before joining Insight. I've worked with MLB, NFL players. And so patients who say to me, they're like, look, man, like you don't understand. I do physical work every single day. I carry boxes at Amazon. I work at a control. I'm physically active. Why do I need physical therapy? My response is I'm sorry, I assume you follow, you watch NFL, you see football. These players are the epitome of physical activity and of strength and of conditioning and all of that stuff. Those same players who spend hours in the weight room and working out and training work with physical therapists, work with specialists whose job, whose training, whose expertise is not being like, hey, let's find out how much you can deadlift today. It's, hey, there's muscle groups that support your shoulder. Let's make sure we take care of all of them, not just one group. Hey, you're having knee pain. Let's make sure the muscular support for your knee is strengthened, is well stretched, and is healthy. So you know what? I have no doubt that I'm not someone who uh, is as physically demanding of a job as some other people. I certainly understand that and I respect that. But just like the NFL, just like professional sports, it is a component. It is augments, it strengthens, it adds to strength, recovery, conditioning, and wellness. So, like you said, it's the floor. It's a daily routine.
It's the
We
floor.
are lucky enough. We are so lucky that we get to see our patients hopefully once a month or every few weeks. But one of my old mentors, Dr. Jeffrey Gooden, used to say to everyone, look, it is 9 a.m. on a Friday. I am so lucky that I get to spend these 15 minutes with you. We can talk about how you're doing. We can make a plan, but then you're going to go home. And today, December 22nd, I might not see you until January 22nd. There's 30 days between now and then. Are you changing your routine? Is there 5 minutes of physical therapy in the morning? Is there 5 minutes of stretching in the evening? It's building these habits. It's making it consistent, reliable, repeatable. So it's something that we add to our lives, something that you add. You're not going to go home and do a steroid shot in your knee every day. Hopefully, we're going to have patients that we're going to be able to get off medications every day. And we add something that's safe, low risk, incredibly evidence supported. None of this is voodoo. None of this is being pulled out of thin air. There is wonderful support talking about how physical therapy changes outcomes, improves functionality, reduces medication. It's a really wonderful aspect. So let's get into this next question. Is because you and I live this every day. So it's like a fish swimming in water. We don't even see the water. A lot of patients have said to me, they're like, hey, you talked about a TENS unit. I don't know what that means. Is there a 9 unit? Is there an 11 unit? And I was like, no, I'm going to try one more time.
I love that.
So why don't you tell me what a TENS unit is, Dr. Rampersad? When you're done giggling, why don't you tell me what a TENS unit is?
That's funny. So a TENS unit is a device where electricity is put through electrodes that stick to your skin and actually stimulate the muscle. So they're used for a number of reasons. We use them for pain because one of the things that we notice, or one of the issues with pain are muscle spasms, and one of the things that these TENS units do are they make the muscles contract and relax and contract and relax to the point where each isolated muscle that is being targeted by this TENS unit is fatigued. So it helps to relax that muscle and get rid of that spasm. The other thing that it does is there's a chemical called substance P, and it's been talked a lot about in the past, but the TENS unit uh, forces that substance P, if you will, out of the muscle so that the muscle doesn't continue to send that substance P to the brain. Okay, thereby decreasing the amount of pain that a person has in a given area. And we use it in, a multitude of muscles, especially the back, the neck, the upper back, as well as the low back, and sometimes even on the legs. And it's a wonderful modality. Physical therapists use it while people are in physical therapy, and people can actually take these units home or buy, or have units ordered for them themselves that they can actually use at home and use this on a continual basis, use this for the rest of their lives.
Sure, absolutely. And so when you say TENS unit, TENS stands for transcutaneous electrical nerve stimulating, and transcutaneous is through the skin. So we've had patients, and I know we've talked about it before, when you say, hey, we're going to give you a nerve stimulator, they mix up TENS unit, transcutaneous, with a spinal cord stimulator or a peripheral
Right.
nerve stimulator, which is an implanted, minimally invasive but an implanted device. So those are as much as, and we can talk about this another time, spinal cord stimulators, peripheral nerve stimulators, vagal nerve stimulators. There's also bladder stimulators. There's all sorts of deep brain stimulators. There's a variety of devices. Those are not conservative care. That is something that is more invasive and it is much more of an interventional treatment. TENS units, transcutaneous electrical nerve stimulators, are I personally categorize them as low risk, safe, conservative treatment. Okay.
Absolutely, because we're not putting anything into the skin. We're not sticking any needles in you. It is simply a
Just
patch, just like the patches for an EKG that are put on your chest. These are put over the areas of the muscle, and they're attached to a little device that looks like an old Walkman, if you
it's like a
remember one
Game
of
Boy.
those,
Yeah.
or a Game Boy.
Yeah.
Yeah, and they have a battery in them, and they just cause the muscles to contract a little bit, just like a little mild. And it's not a shock like, when you were a kid and your friend gave you that shocking lighter. It's
Mhm.
nothing like that. It's not like getting tased. It's just a simple contraction of the muscle.
It's almost sub-perception. Patients have told me
Yeah,
that they can feel it and they can feel the muscles kind of contracting and relaxing. But from hypothetical personal experience, it's not like sticking a fork in a socket. It's very different than that. It's not going
very.
to be that. Very different. Very different. It's good to differentiate those things. Okay. So we've talked a little bit about physical therapy and the role we use it. We talked a little about TENS unit. Let's briefly touch on some of the other conservative care mechanisms that you and I use in our care, including aquatherapy, massage therapy, chiropractic therapy, and we've seen patients do very well with acupuncture and other kind of minimally invasive treatments. So just from that list, all of these are deep conversations, and I'm sure our chiropractic team could talk about chiropractic care, our massage team
Absolutely.
could talk about massage therapy. I recently, and the only reason I bring this up is because yesterday we had a patient who was not able to tolerate physical therapy after bilateral knee replacements. He was miserable. He was quite unhappy. He felt as though walking and physical therapy, since his surgery was only a month or two ago, was very uncomfortable and he could not feel like he could engage in it well. And so, luckily, we were able to work with him for aquatherapy. And so, Dr. Rampersaud, why don't you tell me what you think about aquatherapy or maybe what patients might be a good treat or a good fit for it?
That's a fantastic question. So many patients come in and they tell me, "Hey, Dr. Rampersad, I'm in too much pain to do physical therapy." So there are other modalities that we have. Some people tell me that they hurt too much to do massage therapy. Now, there's two ways that I look at this. We do have other options, such as aquatherapy. And the beauty of aquatherapy, other than you having to get into the pool, is that it negates gravity. So now you're able to do range of motion. You have this cool water around you that kind of aids in the analgesia or the pain relief, if you will. But it allows you to have a full range of motion to do actual strength exercises. You wouldn't believe that you can actually do strength exercises in the pool, but you can with water resistance. And we have instructors who are well versed at teaching people how to do this. And, even people who can't walk or in wheelchairs can actually benefit from this because you're not trying to hold up your own body. You can work on each of these body parts, and people seem to do exceptionally well. And even with a course of this aquatic therapy can ultimately get into doing physical therapy, which leads me to my next point. Any type of therapy that we do, just like going to the gym and working out, it's not designed to be easy. Okay,
For
anything that
instance,
we do is to ultimately help us, and everything requires a little bit of work, and I don't want to say sacrifice, but because you're not necessarily giving something up, you might be uncomfortable, okay, for a time being while you are undergoing physical therapy, aquatic therapy, personal training with the stretching and with the strength training. And usually for the first couple of weeks, you leave there and you're not feeling optimal. You can be quite sore. But, like the saying goes, no pain, no gain. But of course, we're not trying to, hurt you. But a little bit of discomfort ultimately goes a long way. And that will ultimately take us towards some of the other modalities that we think about, including pain psychology, but we'll talk about that in a minute.
oh my gosh, I'm so grateful. You, like, as usual, you read my mind what I was going to next because I want to make sure something. So yes, physical therapy. A lot of patients feel worse before you feel better. Dr. Rampersaud, I know how much you exercise. I know how much you work out. When you're starting a new routine, a new exercise, targeting a new muscle group, how do you feel for the first week?
Oh, absolutely awful. And
Yeah.
I'll give you a little bit of a story that happened to me. I got a spider bite on my arm and I could not use my right arm. I mean, it hurt to do anything. I mean, I couldn't lift a can of soda. I couldn't turn my arm. Um, and it took me with a lot of training, personal training, physical therapy. It literally took me 2 months to get that motion back, and it was not comfortable at all. You know,
How are you doing now?
I'm I'm almost 100%.
That's
I'm almost
fantastic.
100%.
That's fantastic.
So, but you know, there's the mental part of pain. There's the barrier that we have to break through. And once we get through that, that's when we start to achieve, we start to see progress, we start to feel better. You
I
know,
I agree.
it can become very, very frustrating. It can become almost depressing at times because of the lack of functionality, the lack of ability to do things that we previously were able to do. We start to feel like we become a burden to our loved ones who are trying to help us out. And that can create a vicious cycle. It can create a spiral. And we have to have that positivity and we have to maintain that hope and we just have to trudge through it. And sometimes it's not easy. And I mean, it's easier said than done, but that's why we have behavioral psychologists or pain psychologists who can help you through that. That's what Evan and I do also when we're talking to our patients. You know, we're not here just to treat you physically. You know, we're here to be your coaches as well. We're here to
Yes,
help you help yourself.
I agree with that. So
Yeah.
the before I miss it, because while it's still in the back of my brain, I agree the use of aqua therapy, low impact on painful joints, more resistance for all range of motion helps very well. I've seen some great results. Let's talk about what you just before we wrap, before we kind of finish our conversation on conservative care, let's talk about what you just said because it is something that I am so personally passionate about. We love talking about medical health. And then we talk about social health. We talk about smoking and drinking and experiences. We talk about sexual health. We talk about, spiritual health, people with like religion, personal, internal well-being, everything of the sort. I think mental health is not only critical in our overall well-being, it's not just a key or a piece of the puzzle. I believe it is something that A, is not treated with the respect that it deserves. B, is not given the time that it deserves. And C, and this is the big thing, I don't think it's well discussed or explained in medicine as a whole. So, Dr. Rampersad, you are a remarkably kind and like genuine person. And I know we have talked about it. When you walk out of a room and we sit down next to each other when we're both writing notes, you've told me how much you carry it in your heart when you see someone sad, unable to like engage in their quality of life, affecting their relationship, affecting their work, not able to do what makes their soul happy, not able to garden, not able to swim, not able to walk with their grandkids, not able to walk their dog in the morning. And yes, we treat the physical pain associated with this, the knee pain with walking, the back pain after surgery, the shoulder pain because of a broken, we treat that. The aspect of mental health, of pain psychology, is something that is, in my opinion, not focused on enough. And to very clearly say this out loud, when we discuss pain psychology with our patients, we are not saying the pain is in your head, it's imaginary, something is wrong with you, you're working yourself up. We are saying that you want a complete picture, just like physical therapy and medications and surgeries may be components of your care, pain psychology, or having the tools to help support yourself, to help fight against depression and anxiety, to help minimize PTSD is not only military veterans. Post-traumatic stress disorder is found in our patients who survive a terrible car crash, or were horribly injured at work, or have complications after surgery, mental health is not only a component of pain treatment, it needs to be in the conversation in the entire approach to our specialty.
Such an
I think.
important point. Such an important point. And that's the thing that I want to emphasize. When someone comes in, people say, "You just think I'm crazy. I'm telling you about my pain, and you just think I'm crazy, right? Because everyone thinks I'm crazy." No, I don't. I don't think you're crazy. I don't think it's all in your head. Sometimes there's pain that we can't explain, and we need to figure that out. I'm not a behavioral health specialist, but I'm here to listen. I'm here to talk to you about it. And we have behavioral health specialists here at Insight who I would refer you to. In fact, the majority of my new patients, if I suspect if this is a chronic pain issue, sometimes even with some of the acute care and acute pain issues, especially if it was a traumatic event, such as automobile accidents or assaults, I immediately get people in to the behavioral health clinic so that they can at least discuss it with someone who is even more qualified to address those issues. And we try to catch them early on because, again, just like stretching, just like strengthening, just like all of that, taking care, just like Evan said, of your mental health sometimes requires lifelong treatment, lifelong counseling, and maybe not even counseling, maybe even just talking to the counselors or the psychiatrists to learn techniques to deal with stress and to deal with pain mentally can be a lifelong gift. When you have these tools at your disposal, it's a lifelong gift.
You're exactly right. We are not saying to patients, hey, you need to speak to someone 3 times a week. We're not saying, hey, you need to do physical therapy 2 hours a day, every other day for the next 10 years. We are saying there's a reason why Dr. Frankie, as a mental health care practitioner at Insight, is where he is. There's a reason why Narav, as a physical therapist at Insight, is where he is. We are here to give you tools to best support and help treat you. We do as much as we can when we are with you and put our hands on you, but you live most of your life not in contact with us, not around us. And these are additional tools, whether it is mindfulness, whether it is therapeutic conversations, whether it is stretching, whether it's physical therapy, whether it is home exercise programs. These are tools that we are giving you to help build the best chance to move forward from the symptoms that you're having and to get all the help and as much assistance as we can possibly give. So, Dr. Rampersaud, you and I, the problem is when we start
We
talking,
can't stop.
we can't stop. So I'm going to
We can't stop. Yeah,
force us. I'd like
yeah.
you to. So, Dr. Rampersad, we talked about physical therapy. We talked about conditioning. We talked about the role it plays. We talked about transcutaneous nerve stimulators, aquatherapy. We talked about mental health and pain psychology. I'd love you to give us some final thoughts or kind of like a 30-second summary on what your use, thoughts, and future direction for conservative care in your treatment of your patients.
I'll tell you now my thoughts on conservative care are they are the foundation of any treatment that we do. And going through, just like Evan said, all of those modalities that we talked about. And I encourage uh, the patients who do come in to see us or see any pain management individual have a very thorough conversation with their pain management doctor about some of these modalities as well. Because I can assure you that these modalities are something that you can take with you lifelong. They're lifelong help modalities. And I mean, in addition to the other treatments that the pain doctor will give you, but I encourage you to just heed our words. The This truly is conservative therapy will be around forever. You know, medical treatments come and go, they change, they shift. But the foundation, the conservative treatment will be there forever, and that is something that you will always have.
Agreed. I think we've covered a wide variety of modalities of treatments. And I think the bottom line is we need to realize, and medicine as a whole needs to realize, pain management is not Tylenol, please, like Tylenol,
Right.
like that's not pain management. Pain management is multimodal, complete, comprehensive treatment of the symptom of the chronic pain that has brought someone in to see us, as we are lucky enough to be involved in their care. So we, just like Vince said, if you have a question, you're like, hey, tell me more about TENS units, or hey, I've been reading about acupuncture, or hey, can you recommend an aqua therapy for us? We encourage you. We are lucky enough and grateful enough that we are involved in your care, but self involvement, or involvement in self-care, and having some internal locus of control, having some ability to take ownership of your care, of the direction of your treatment, is wonderful, is empowering, and is beneficial for long-term outcomes. So, Ramp, we never have enough time,
We
ever.
never have enough time. We never
We
have enough.
always talk more. I didn't even get into the fact that we talked about that. Correct me if I'm wrong. You're launching your rap debut album under the name Substance P, aren't you? I love that. So
First of
iTunes
the year,
parody.
look for it.
Exactly. Substance P, rock out. Anyways, always more to.
Substance P.
I would
I
listen.
love it. I
I
love
like
that.
that.
Love
Yeah.
that. That's
So again, Dr. Rampersaud, a pleasure as always. I'm Dr. Peskin, one of the pain management physicians at Insight. This is Dr. Vince Rampersaud. If you have any questions, if there's anything you'd like us to talk about, you let us know. And as always, no pain, no gain. Thank you for your time.
right. See you, buddy.